I'm now going to show you the total scores of the whole group of patients, the 16 patients. The top line shows you between group effects. That is, we're comparing the patients who received the therapy at the beginning with the ones who are only getting treatment as usual. So they're the controls. And you can see that the hallucination score, the SIRATs, goes down by 9 points, which is highly significant. The beliefs about voices questionnaire goes down by 6 points, which is highly significant, but there's no significant change in depression. Then the next line underneath is looking only at the control group, and then we're comparing the period when they're receiving treatment as usual with the period where they cross over into getting the therapy. And you'll see it's exactly the same pattern, significant reductions in the hallucination score and the depression score, but no change in depression. Next, please. Right, now this is the 3-month follow-up after treatment, and you'll see that the hallucination score, the SIRATs, has continued to drop, and in fact it's a significant reduction. Now, there was a number of planned subsidiary analyses. A reduction in suicidal thoughts, significant reduction. Now that, of course, is clinically extremely significant because of the high rate of suicide in patients of this kind. The power calculation was based on a reduction of the omnipotence score of 35%. And in fact, at the end of therapy, it had gone down by 29%. But at the end of the 3 months, it had gone down even further to almost 40%. Next, please. So what can we learn from avatar therapy? Well, what's new about it, apart from the therapy itself, is that the introduction of an avatar allows us for the first time in 100 years of psychiatry to study the relationship between the patients and their voices at first hand. Kraepelin himself said, what the patient may disclose to us in the course of the interview is always a secondary product. We are always confronted with the question, what is the primary experience traceable to the illness? And because the therapist joins in the patient's experience, listens to them, follows them through their passage of their, through the hell they're living through, it's possible to understand what the patient's experiencing. Now, how does it work? Well, I think there are a number of different issues here. First of all, the therapist is validating the patient's experience. In the past, it had been the regular thing to say to patients, don't listen to the voices, it's a lot of nonsense, they're just your mind playing tricks on you, and that wasn't helpful. But the patients interact with the avatar as though it is a real person. But since it's their creation, they know it can't hurt them. So we tell them, you're in a safe place, you can try out various strategies to oppose the avatar without having any fear of retaliation. Because often the voice says to them, if you do this, if you do that, I will harm you, I will kill your family. So they learn to stand up to the avatar and take control of it, and this generalizes to the persecutory voice, which we know now leads to a reduction in its perceived omnipotence. Next, please. Now, during the course of the therapy, as I've explained, the avatar changes its nature, ceasing to abuse the patient after 1 or 2 sessions and gradually becoming friendly and supportive. And this change results, as we've seen, in a reduction of the perceived malevolence of the voice. And in my view, because the voice is no longer threatening, the patient is able to reintegrate that externalized voice into their mental space. And of course they can use the MP3s to listen to the sessions whenever they hear the voice. And this may explain the further improvements after the end of therapy. The next slide, please. There are 2 publications on avatar therapy. The first was in the June edition of the British Journal of Psychiatry. And the second, please, next slide, is online in the journal Psychosis. And it tells you not only what it's about, but it gives, much as I've given to you now, suggestions as to why it works. Last slide, please. Now, this was an extraordinary result for us, and we never expected anything like this, but it means that we had to see if anybody else could replicate it. And furthermore, it's a small study, So we put in an application, myself and Professor Tom Craig, who's an old colleague and friend of mine, with the Wellcome Foundation for a much larger study, and we're now planning to recruit 140 patients. And the other therapists are going to be trained, including 2 men and 2 women. The primary outcome, of course, is reduction in the severity of auditory hallucinations. The effect size of my pilot study was 0.8, and this new study is going to be powered to detect a moderate effect size of 0.7. So my role has to be hands-off, because one of the issues is it purely my magic? Can anybody else do what I did? So I have to train the 4 therapists, and I've already started that. Been going at it for 2 months, and I must say I'm very pleased with how well they've done. They've actually produced some changes in the patients quite rapidly, so it's looking very promising. When we got the grant, it was from the Wellcome Foundation. They gave us £1.3 million to do this this replication, but they insisted that we had to have an active therapy. And after 2 months of discussion, we agreed to have supportive counselling as the active therapy. So we'll now have randomization for either to avatar therapy or to the supportive counselling. It's expected to take 3 years, this study. It's not a quick fix, so we'll be watching with interest what happens. And if it's successful, then there is no doubt at all that we will go global. Thank you for your attention.